The magnitude of the protective effect was surprising.
Researchers call it a foundational study, a glimpse into just how effective safe supply could be when it comes to preventing fatal overdoses.
Currently, 7 people are dying per day of illicit drugs here in BC, and so it was a really promising finding.
The research was led by scientist Amanda Slonwhite, who followed participants in BC's Risk Mitigation Guidance, a program aimed at curbing overdose deaths during the pandemic.
In the early weeks and months of the pandemic, we started seeing a large increase in overdose, and particularly overdose deaths.
More than 5,800 people with opioid or stimulant use disorder were studied between March 2020 and August 2021. Those who were prescribed a pharmaceutical opioid showed a 61% lower risk of death from any cause the following week. They were also 55% less likely to die of an overdose. Patients who received prescriptions for 4 days or more were 91% less likely to die from any cause and 89% less likely to fatally overdose.
It was a promising intervention in terms of reducing death, which of course is all too frequent.
And the state of the unregulated drug supply is more volatile and more unpredictable than ever.
This Vancouver Island nurse who works in harm reduction says the study's findings validate what many healthcare workers see firsthand.
We're seeing that people are able to reduce their reliance on the unregulated drug supply. We see improved functionality and quality of life. We see a reduced risk of death, infections, and harm.
Still, the BC CDC says just 5% of people grappling with substance use disorders have access to prescribed drugs.
If the numbers are there, the numbers are there.
Frustrations from advocates like Dave Ham that programs aren't easily accessible.
The government needs to step in, give us a regulated, safe supply of these street narcotics.
A tool that shows promise to curb a mounting overdose crisis that's claimed more than 13,000 lives. John Hernandez, CBC News, Vancouver.